Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Today on Mahaska Health Medical Minute is Chief Medical Officer, Board Certified in General Surgery, and a Fellow of the American College of Surgeons, Dr. Tim Breon. Dr. Breon, thank you. Let's touch a little bit on your background and tell me about you. I know the community holds a special place in your heart. Tell me something you enjoy. What are you about?
I'm about surgery. I think rural healthcare delivery is really important to me. My grandfather passed away here when I was in second grade of a ruptured spleen from a tractor accident, and I'm from Hedrick, so about 30 miles away from here. And so that always seemed to be something that I always thought about a lot when I was in training. It kind of kept me grounded in that. I felt rural healthcare was something that I was motivated in. I wanted to be able to do things that would protect agricultural workers. Did my master's degree in public health and specialized in agricultural health, particularly pesticide exposure, but also just safety and awareness. And I come to realize that maybe the best way to take care of agricultural workers was just to work in a rural community where you could just take care of them one-on-one. And from a surgical standpoint, we get to take care of them when they injure themselves or when they come in for screening procedures or when they come in because they've got a hernia. And so just making that connection and being able to communicate with people that have a rural mindset and a rural background, it's fun to make that connection. And I feel like I'm doing my part and doing the things I'm made to do just for that special population. Yeah, and I just, they talk my language, I talk their language. Yeah. You can connect with people.
It's a great way to put it.
Yeah. And I think, culturally, it's just a great fit.
It's a good fit.
Yeah.
2020, in your own words, tell me about your 2020, your year of 2020, I should say.
It's been an interesting year. I think I don't look at it as a devastating year like a lot of people do. I think it's been a year with lots of challenges, but also it's posed lots of opportunities. And so from that, I think Mahaska Health as an organization, I think really learned to solidify some of the things that we've been talking about for quite some time. The previous 2 or 3 years kind of culminated in the opportunity that we had to, as a team, come together and make some plans to deal with coronavirus. And so that in and of itself allowed us to have more effective communication than we'd ever had because we had something that we needed to communicate about on multiple levels, from providers and staff and just every part of the hospital that had to take a part in that. We learned to communicate in ways that we hadn't really had to or been successful at in the past. So that's helped us, and that's built a team that I think is now motivated to apply those same principles to everything that we pursue in 2021 and years to come.
We had to learn to work parallel along with a pandemic. So we, instead of just COVID patients, we had to continue to care for others.
Yeah, and we've all been learning simultaneously, So at first, we didn't know what to think of coronavirus when it first started. So our main goal was just to keep everybody safe, our own workers and our own staff and our own providers and our own community. And then it evolved into how do we keep people safe? And that was to figure out a way to continue to do healthcare in the midst of a pandemic. And so that's taken a lot of teamwork to facilitate that and to make it happen.
Present day, what do you see the positives are today?
Yeah, we're just a more cohesive team. I think a team that knows that we have to rely on each other. None of us can do it by ourselves. We've learned there are people that have skill sets we didn't know they had. So we've got some people that have just risen to the top that have been really a blessing to the community, to the facility. And so, yeah, I think we have a better team than we would have without it, I believe. It's been a big challenge. Would we redo it and not have to go through all that? Sure, but at the same time, we don't have those choices. So it's nice to look back and say we were posed with a challenge and we confronted that with the skill sets that we have. And like I think we expect to have happen anytime we're given a challenge here at Mahaska Health, I think we've come out better for it.
The calmness that you expel from you, the calm and how you've captured the hearts of the patients and employees through all this is just unreal. And so that's so great to see that across the hospital. Looking forward, so we've touched on the past, we've touched on present. Moving forward, What are you most excited about?
In the future, I'm most excited about just taking these principles that we've been building the last 3 years, 4 years, combined with a lot of the big changes that came with coronavirus and managing the pandemic, and then applying those things to the positives that we have coming in just this 2021, mainly including a bunch of new providers that we've been recruiting for some time, some new additions to the hospital to facilitate those providers, just the culmination of years of work that's really going to come to fruition later this year. So it's very exciting to see the timing in all this. I couldn't have timed it any better if I would have done an exercise for the whole medical community that would have put us in a position to be ready for the things that we have coming on the horizon. It would have had to look something like the pandemic. And that's been a blessing, even though it's been a challenge. And so I believe it's got everybody excited for the future. Everybody wants to stretch and move beyond this. And I think the thing that we're stretching to is the opportunities that we've been given. And that looks like new providers, and that looks like some additions and some changes just in the way we do things here. I think as a result, the community has come to trust us in a way that they haven't trusted us for a while, I believe. I think we've earned their trust through this, and I certainly hope that we have. That's certainly been our ambition. And I think to follow that with the new providers that we have coming this fall, this summer and fall, some of the new changes, some of the new clinic space that we'll have, a lot of the changes from top to bottom, I think people are going to see that. They're going to expect it, but they're going to see it and they're going to appreciate that.
Dr. Breon, you are a gift. It's always an honor hearing your insights. A heartfelt thank you for all you do every day. I can always see your compassion and love for the patients, and what you do as a surgeon really come through in your words. So thanks for coming in today.
And I think, to tag on to that is, we're blessed so much as providers. As a surgeon and as a chief medical officer, I can't think of having a fuller year than I've just had in terms of the opportunities that we've had, because those have provided lots of challenges, but so many blessings. I feel like we've really been blessed, and I feel blessed just to get to be a part of it.
Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday. Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.